good. All right. Okay, so Lisa, thank you so much for sharing your experience and your plastic surgery journey with our patients and future patients. So what was the reason why you wanted your implants out?
Well, initially I met Dr. Brown over 12 years ago and had a breast reduction, but then implants to give me a lift. And
Wait, you had a breast reduction and then added implants?
Yes.
Okay.
Back, that was 13 years ago.
Okay.
Yes.
Wow. All right.
And then, obviously with aging and getting near menopause, I had built up a lot of extra tissue that made the original work just less flattering. And so I talked to Dr. Brown about how I was feeling and how I felt I looked, and she had recommended the reduction and removal of the implants. And I was nervous about that, but I explicitly trust her. And so coming in, I am so glad that I did the procedure, and right now I'm 4 months later. I feel lighter, I feel healthier, and I'm very glad that I did it.
That is amazing. And how did you feel like your recovery went and all of that?
Well, Dr. Brown is obviously very good at what she does. I know several of her patients are family and friends of mine, and I think it's just great that she and her staff from the beginning spend the time going through all the possibilities with you and preparing you, not in a negative way, but for the worst case scenario. So when you go through the procedures and you go home and you start your recovery, you're really prepared for it. And I think that she and her staff did a great job of preparing me for that, and I've healed quite quickly. And really nothing felt like a surprise or a terrible situation to get through because I was prepared for the worst. So in my mind, it was quite the easy recovery.
You know, it's interesting that you say that because I have worked for, other plastic surgery practices, and they don't really go through a whole lot of the recovery. I mean, they kind of touch on it a little bit, but it's almost, where it can sound intimidating and scary. But I have to say, every single one of her patients has, since I've been here, never had any problems with their recovery because she does such a good job of managing expectations, but managing the recovery, saying this is what's going to happen, this is how you're going to look, this is how you're going to feel.
Yes.
And when you know that up front, you're prepared.
Yes.
But when you don't discuss that, when those things happen, it could be so frightening.
It can
like,
be.
Oh my gosh, is this normal? Is this, is it supposed to look this way?
Right.
But she does such an amazing job, and she's so honest and upfront.
Yes. Very thorough as well. So not only did I have the packet of pre and post surgery outlined with every detail, I sat with her in the office prior to the surgery and she went through everything again. So very thorough, and then gave me an idea of the percentage of likelihood that I would experience different things.
Right.
And so that really helped me get my mind around it and prepare, because surgery is a mental commitment as much as it is a physical one.
And financial one.
And a financial one.
For sure.
But it's a good investment, right? An investment in you.
Yes.
So I really just appreciate her thoroughness and speaking at the level of a doctor, but also speaking in layman's terms so that I understood and it wasn't overwhelming. And I think all of that just helped for a really happy and expeditious recovery.
And because she's a woman and she actually has gone through it herself, that does make such a big difference.
Absolutely.
Well, Lisa, thank you so much. You've been such a great patient. We appreciate you. We appreciate your trust in her, and I'm so glad that you're happy.
Thank you.